Hey, welcome back to Healthcare Consumer Radio. This is Doug Field, your co-host, along with Ron Bachman. And we've got exciting segment coming up, and we've got an individual here that not only represents as Senior VP and Chief Marketing Officer of Prime Therapeutics, but Michael Showalter is no newcomer to healthcare consumerism. And he's been in this industry for quite some time, was at Definity, was at Cigna, was even at Ebix years ago, and now heads up product development and marketing for Prime Therapeutics. Mike, welcome to the program.
Hey, thanks, Doug. Great to be here.
Yeah, great to talk to you again, and good to have you here. And we'll be seeing you soon out west, too.
Yeah, I'm looking forward to that. Sounds like a great event you guys had.
Hey, Mike, tell our audience a little bit about Prime Therapeutics. Kind of give us, kind of what your position is in the space, and then we'll get into some of the other discussion points.
Sure. Prime Therapeutics is a pharmacy benefit management company owned by 13 not-for-profit Blue Cross and Blue Shield plans. We got about 21 million members across the country today. We've had a nice little run over the last few years with a compound annual growth rate in the 15 to 20% range, and then drug spend under management in the $15 billion range. We have today, in the individual market specifically, we enjoy the position of being the second largest PBM in the space with about 2.3 million members covered in the individual market.
You're kind of the silent giant out there.
Well, we are. With that Blue Cross and Blue Shield brand, which is the segment we serve, is a really powerful brand. Yeah. So we like to let that brand carry the consumer brand, and then we power the experience behind that.
Excellent. Mike, the whole world's about to change. We've got the emergence, maybe, of the public exchanges, and certainly the execution and soon-to-be participation of X number of employees and their families in the private exchanges. Talk to us about what you see as the impact to the pharmacy benefit management space.
Yeah, well, first and foremost, I would say the good news about the public exchanges is we have access to a lot of people that never had access before, so I think that's a terrific thing. And people may not think about the impact of what that means actually in the pharmacy benefit space. And importantly, the interactions that these people are going to have with their plans are going to largely be related to pharmacy. So let me give you a simple example. We know from our own database that the average person uses their pharmacy benefit about 11 times a year. And the average individual uses their medical benefit 1.7 times a year. So whether it's a health plan or an employer, their brand, their reputation, a lot of what's on the line for them is going to be how the interaction goes with that pharmacy benefit. So importantly for us, we think it's a great time to show the consumers and show all of our constituents, just how well we can serve individuals and how that can be an important part of a happy consumer in the healthcare space.
Hey, Mike, it's Ron Bachman. How you doing?
Hey, Ron, what's it been? Over 15 years we've been helping the consumer to improve healthcare?
We've been crossing paths in many ways all the way back. People listening into this ought to know that you were really with one of the very early founding companies, Definity, to start off this whole revolution here. You and Tony Miller and many others that were involved with all this really started this off in early 2001, 2002 time period. So you've been involved in trying to help consumers out there get better products and better services and more choices and options and have more convenience as much as anybody in the industry out there. So I congratulate you on what you're doing. Now you're trying to help out with people to understand the pharmaceutical industry and their prescription drugs. Tell us what you're able to do out there that may be a little different to help people understand, get involved, and be compliant with their medications, know what to do. How are you helping the consumer with what you're doing today?
Some of what we started with back, maybe going back 2 years ago, is at first it have to start with a company that actually believes in serving the member. Mm-hmm. So we redid our mission. So importantly, we had back then our employees, only 21% of our employees could recite our mission. So we relaunched a new mission that was based on where the puck was going, based on how we saw the consumer rising in healthcare. And we launched a new mission that was completely built around the member. And now today, 91% of our employees know our mission. So it starts with having a mission that's focused on the member, which is to help people get the medicine they need to feel better and live well. And we got a little bit lucky, and the Public Relations Society of America recognized us, gave us a silver anvil. I was pretty excited that day. That was a professional high point. Then it followed by, in June of this year, specifically for members on the exchange, we launched a website called Prime Helps. Prime Helps was an educational website to sort of demystify the world. So we did some very simple things, starting with how do you speak common language? So this is not a complicated thought, but we demystified the jargon, and that starts by developing a very deep hatred for all jargon of any types across the enterprise. And so we can demystify the language that people are speaking so that people can actually understand us. We know, for instance, in the exchange, we expect, based on some research we've done, that something like only 17% of people in the exchange will have had any kind of college education, which means we have a population that you need to speak at in a very common tone. So we have a rule around here, an interaction principle we call it, that all of our written communications, digital or over the phone, have to be at a 5th grade level. So then we launched these things we call interaction principles, which was communications has to be from someone and to someone. You have to take and demystify the corporation. It has to be from somebody and to somebody. The rule is if it's worth sending, it's worth putting your name on it. So make things common language. Always speak in the member's preferred channel. So whether it's email, paper, or phone, figure out how they like to be communicated, meet them there, and never ask a person to complete more than 3 steps. So if you want to get something done with the consumer, you can't have them do more than 3 steps. And so whether it's a web or whether it's filling a prescription or accessing their benefit, it can't be more than 3 steps. So it was really simple things like that we started the organization on, and then from there we're just building out our ability to meet the individual with where they are.
Sounds like a process that I might even be able to understand, get down to my 5th grade level.
You know what? I think you could even put your brain around that one, Ron.
I'm looking forward to learning more. I'll have to get involved more with your website. There's an old saying that all learning occurs in the mind of the listener. And I think that's what you've done, the way you've described it. You've said, let's go to the client. Let's go to the person we're sending the message to and talk in their language, talk at their level, talk in terms that they can understand. So I think you've really taken that old saying and made it reality for your organization.
I appreciate that. We'd like to think so. I'd encourage all your listeners to get out there to primehelps.com and see what we got going on, because I think it's something I'd encourage everybody to copy. Let's make this work for the people that are going to be on the exchange.
Mike, what do you see as the opportunity for Prime? Because you're talking a lot about the public exchange. So what do you see as the opportunity with the private exchange market?
Well, I think private exchanges are a really unique thing and have been really good for us so far. So I'll tell you, going back to my days, you guys may not know that I was at a company called eBenX that did private healthcare exchanges in the mid-1990s.
Yeah, we did know that.
Fortune 100 companies. One of the cool things about that experience was I started to realize how powerful the Blue Cross and Blue Shield brand is in the mind of the consumer. So I came into Prime with the assumption that Blue Cross and Blue Shield was going to actually be a big winner in private exchange and public exchange business, and that their brand would be an important part of carrying that day. I saw that at eBenX, and then last year we had some private exchange business when Sears announced they were going to do a private exchange, and when Darden Restaurants announced they were going to do a private exchange. And our enrollment went from 30% of the population to almost 70% of the population in those 2 instances. So I'm feeling pretty bullish about our opportunities on the private exchange. And let me just tell you one thing to be aware of when you do private exchange business from the pharmacy side. A learning for us, a lot of people don't pay a ton of attention to what covered drugs are in the pharmacy benefit. So simply speaking, insider baseball, they call that a formulary. Right. But in common language, what's the covered drug? So people are signing up for these exchanges. They don't realize, they think it's great because there's all these choices. And Americans love choice. Who doesn't? You get all these choices. You get to pick whatever you want. There's also an element of make sure you know what you're picking, because you may assume just because something was covered last year that it's on a private exchange, it's going to be covered next year. Not always the case. Mm-hmm. Each one of these plans has a different set of coverage. So look at the price, but also look at what you're buying when you get on these private exchanges.
Mike, tell us a little bit again about your organization. It's owned by the not-for-profit Blue Cross Blue Shield. Is that what I heard?
Yeah, we're owned by 13 of the not-for-profit Blue Cross and Blue Shield plans.
Okay, so if somebody wants your services, do they have to access it only if their coverage for their medical is under Blue Cross Blue Shield, or do you offer your PBM services to other organizations?
Today we offer primarily through Blue Cross and Blue Shield. We don't sell directly to the individual. Mm-hmm. Last year we entered into a very unique relationship with the Human Resources Policy Association, mm-hmm. HRPA, in which we could offer our benefits directly to employers. One of the reasons we entered into that agreement is we were sort of mentally aligned and our missions were aligned, which was to let's make pharmacy benefits about the member, not mm-hmm. about lining some shareholder's pocketbook and sort of demystifying the pharmacy benefit. So that was an important new entree to us. But when you think specifically, Ron, about the exchanges, people are going to buy the whole benefit. They're mm-hmm. not going to just buy pharmacy. They're not going to just buy medical. They're mm-hmm. not going to just buy durable medical equipment, whatever you have.
Right.
They're going to buy that whole benefit. So right now, when it comes specifically to public-private exchanges, everything's bundled up there, and their buying purchase decision is with Blue Cross and Blue Shield.
Okay. So at the end of the day, then, if an employer wants to come to you directly, you're saying you're able to do that through this other outlet, so that, again, I'm trying to be sure our listeners know that the opportunity to get coverage through your organization.
Absolutely. We welcome employer business. We'd be happy to talk to any employer out there who wants to come directly.
Well, Mike, listen, we've got about 45 seconds to go. Time flies when we're having fun here. Give our audience a couple clear takeaways that you'd like to leave them with, please.
Yeah, just from a takeaway standpoint, I would say make sure you know the experience is simple. Make sure you're understandable to the average individual. You only have one chance to make that first impression. So whether it's our mission, our unique connections to the Blues plans, or superior experience, we're just feeling really bullish about the future and about the future of the consumer in healthcare.
That's exciting stuff, Mike, and I really appreciate you being here. And to our audience, you can join Mike at IHC Forum West December 5th and 6th, where you could attend his workshop, so we urge you to do so. Mike, have a great weekend, and we'll see you in Las Vegas.
Thank you, gentlemen. Look forward to it.
All right, thanks again.
Bye.
To our audience, stay tuned for the next segment, Healthcare Consumerism Radio.